Hello everyone. I am Sanjana, Onco nutritionist from zenonco.io. Today we shall be speaking about oral health in cancer patients. Some of the cancer treatments which a patient is going to be undergoing is going to be causing side effects, especially to the mouth area or to the lower area. Right, so let us try and understand as to what are the how a treatment is going to be affecting the mouth, and also today we will be seeing some general tips or guidelines which will help in taking care of the oral hygiene as well. So what happens is certain chemotherapy or targeted chemotherapy drugs, they can damage the healthy cells of the mouth, and this can cause mouth sores or infections. As we know that chemotherapy is an aggressive treatment wherein the cancer cells are going to be destroyed and also the normal cells are going to be destroyed as well. Generally in mouth cancers or head and neck cancers, we tend to see that most of the common side effects or symptoms due to either a chemotherapy or a radiation is mouth ulcers as well. Why? Because it is going to be damaging the healthy cells in the mouth. Okay, now especially also when radiation therapy is given either to the head, neck, or even to the upper chest region, this can cause an injury to the cells which are present in the mouth, and also the salivary glands can also be affected. Now due to this, what happens is most of the time we see that the patient tell that they are getting a loss of taste or taste alterations as well, due to which they find it difficult to consume the food because it is not much appealing also and not having any taste. Also they can sometimes experience difficulty in swallowing, otherwise what we call it as dysphagia as well. Even if a surgery is done to the head and the neck area, it can also be having an impact on the ability to chew and swallow. And during this time, it is extremely important that we modify the diet so that it can be seen to it that the patient is going to be getting a good nutrition as well. Before your treatment is going to be starting, it is always important to get a consultation done with the dentist, who is going to be understanding the effects of the treatment, and they will be helping you and guiding you as to what are the important oral hygiene tips to be taken care of before actually your treatment is going to be starting. So for a dentist, it is going to be important to understand if you are having any teeth problems or any tooth decay as well. Alright, so that is very important to be taken care of. So now let us try and understand some of the tips or the guidelines what can be incorporated or implemented so that it will help in improving your oral health. So I'll be speaking over here regards with the dietary part as to what can be done. So first of all, what we need to do is we need to focus on soft and nutrient rich foods. Always choose a food which is easy to chew and swallow rather than choosing for hard foods, especially if you're going to be having a mouth sore or dryness of the mouth which is commonly present. Soft foods are well tolerated, and like vegetable smoothies and soups, so these are also going to be nutritious and gentle on the mouth. Try avoiding strong flavored foods or spicy foods which again would irritate the mouth, as already the patient might be having mouth ulcers or dryness in the mouth. Especially if you are having dryness in the mouth, it is important to consume sips of water throughout the day, and also you could suck on ice chips or ice cubes also. So Especially if a patient is having mouth cancer or head and neck cancer, we emphasize and encourage them to drink plenty of fluids throughout the day, so that it will help to keep the mouth moist, and also it will help in reducing dryness as well. Water, yes, is the best, but you can also include herbal teas, diluted non citrus juices. Now, why diluted non citrus juices is because citrus juices are going to again sting if the patient is going to be having mouth ulcers. Avoid irritants, most important. So you need to avoid spicy, acidic or crunchy food which can again going to irritate the mouth sores or a sensitive mouth as well. Okay, now what are some of the key nutrients which you can include in the diet, which are going to be also helpful, and they're going to play a role also in helping the healing of mouth ulcers, or play an important role in wound healing as well. First of all is vitamin A and vitamin C. These vitamins are known to be helping in the healing of the mouth sores. You can include carrots or sweet potatoes, bell peppers or capsicum and orange into your diet. So these fruits or vegetables, they contain vitamin A and vitamin C as well. Zinc. Zinc is an important mineral which has been shown to be playing a role in wound healing. Some of the rich sources of zinc which you can incorporate in your diet are legumes, nuts, and seeds. Omega 3 fatty acids. Omega 3 fatty acids have been studied a lot because of their role as playing in anti-inflammation. So they play a role in reducing the inflammation. So you can surely include flax seeds, chia seeds, nuts and seeds, which are good plant sources of protein, and they are also rich in antioxidants as well. So to summarize, good oral hygiene is also very important because it will be helping in taking care of the mouth, oral hygiene also. Also, to you need to include easy to chew foods, basically soft foods. Okay, and so to incorporate foods which are rich in vitamin C, vitamin A and zinc also. Try to avoid irritant foods as I have explained to you in today's video. Thank you so much for watching my video. We at zenonco.io are here to navigate you through your cancer care journey. In case of assistance, you can surely reach out to our cancer coaches on the below mentioned contact number. Thank you.